Let's see the clinical anatomy of the thyroid gland. Here in this figure, we can appreciate the side view of the thyroid gland along with the arterial supply and the nerves concerned with the thyroid gland. Thyroid gland is going to be supplied by two arteries. One is the superior thyroid artery and one is the inferior thyroid artery. The superior thyroid artery is a direct branch from the external carotid artery, and the inferior thyroid artery is a branch of the subclavian artery. The superior thyroid artery, it is more in the intimate relation with this external laryngeal nerve, which is actually a branch of the superior laryngeal nerve of vagus nerve. And the inferior thyroid artery, it is in the intimate relation with this recurrent laryngeal nerve, which is also a branch of the vagus nerve, which is going to make the loop around the arch of aorta on the left side and the right subclavian artery on the right side to reach up to the thyroid gland. This external laryngeal nerve gives nerve supply to the cricothyroid muscle of the larynx, and the rest of the muscles of the larynx are supplied by this recurrent laryngeal nerve. So after having this much information, we can say that the superior thyroid artery is very much in contact with the upper part of the external laryngeal nerve, or we can say initial part of this external laryngeal nerve. While as soon as the superior thyroid artery reaches the upper pole of the thyroid gland, the external laryngeal nerve is little apart from it. And that's why at the time of the thyroidectomy, we have to ligate the superior thyroid artery to prevent the bleeding. And this ligation of the superior thyroid artery should be more nearer to the upper pole of the thyroid gland to prevent accidental injury to the external laryngeal nerve. While in case of the relation of the inferior thyroid artery and the recurrent laryngeal nerve, at the lower part, or we can say at the proximal part of the recurrent laryngeal nerve and the inferior thyroid artery, both are apart from each other. But as soon as this artery and the nerve reaches up to the lower pole of the thyroid gland, they are in very much intimate relation with each other. And that is the reason at the time of the thyroidectomy, we need to ligate the inferior thyroid artery, and we should ligate the inferior thyroid artery as away from the lower pole of the thyroid gland as possible to prevent the accidental injury to the recurrent laryngeal nerve. So this is the very much clinical important understanding regarding the ligation of the superior thyroid artery and the inferior thyroid artery during thyroidectomy.